So a cataract is when the lens inside your eye goes cloudy, and that will result in patients having misty vision or perhaps not able to see what they could previously see well. Sometimes cataracts come on very slowly, and so patients aren't always aware of how bad things have got. Sometimes patients will fall below the driving standard and not be aware of it. Sometimes it's much more obvious. They might close one eye and suddenly notice they can't see out of one eye. So everybody nowadays will receive a lens implant. The standard lens would aim to correct someone for fairly good distance vision, which is the normal way for people to be at the age they normally develop cataracts. Some patients prefer to be left short-sighted, and that's also possible if that's their preference. Some people have quite a lot of corneal astigmatism. That means the shape of their eye is a little irregular, and if they had a standard lens, their unaided vision after surgery might be quite blurred. So we have the option in that situation, if appropriate, to use what's called a toric lens to try and correct for that astigmatism. There is the option to use multifocal lenses or extended depth lenses in some patients. And this can have the effect of reducing a patient's dependence on glasses and possibly not need glasses at all. So most cataract surgery is done under local anaesthetic, and so there's not really a need to perform both operations at the same visit. However, in some situations, patients would prefer this, and it's certainly possible, although it's certainly not my routine practice. So unfortunately, any operation carries a risk, although risks with cataract surgery are quite small. Maybe 1 in 1,000 patients may get an infection or unpredictable bleeding at the time of the operation, which could potentially blind the eye. So it's important that there's a good reason to proceed with surgery. Most patients that have cataract surgery will achieve much better vision, and indeed some patients who've had large refractive errors their whole life will suddenly find that they see in a way that they've never seen before. For most patients, visual recovery is actually very quick, so within a few days most people are seeing better. Occasionally it can take a number of weeks to settle down. The post-operative management is quite simple. It's drops, normally 4 times a day for a couple of weeks and then twice a day for a couple of weeks. But normal activities can be resumed within a few days, actually. The only thing to be really careful of is not to poke or rub the eye in the first week after surgery. Otherwise, most things that normal people do can be resumed within a few days. Driving is often possible fairly soon after the operation, as long as the visual requirements for driving are met, which is reading a number plate at 20 yards. Some patients may need a small correction in the form of glasses to achieve that. Glasses are normally prescribed about a month after surgery.